would a pregnant or breastfeeding mom have reasonably expected disclosure of things like the fact that Health Canada has not approved any safety claims with regard to pregnant and lactating women, that the manufacturers never asked for their shots to be given to these women, that no data were submitted to support giving these shots to these women, that Health Canada was investigating early post-marketing surveillance data showing that for breastfeeding moms that had inadvertently received the shots, 21% of their suckling infants had clinical issues, or how about that 24% or 25% of the moms had breastfeeding issues as a result of getting these shots? And should evidence of naturally acquired immunity been accepted as reasonable evidence of immunity for these women rather than mandating these shots to them? These are just some of the questions.
For Rebel News, I'm Tamara Ugolini, and I'm at the screening of the documentary Why Can't We Talk About This? That details the severe health decline of Michael Osh following his fourth COVID-19 vaccine. And I'm joined by virologist and immunologist Dr. Byram Bridle to talk about the latest science and discuss the discrepancy between what is happening in the United States with their restriction of the COVID shots for healthy individuals, including pregnant, breastfeeding women, and young children, and what the Society of Gynecologists and Obstetricians has just released, clinging to this safe and effective narrative. Dr. Bridle, can you run us through the science and what you have here refuting and debunking their claim?
Yeah, sounds good. So I have to tell you, Tamara, I was very shocked when I saw the statement come out from the Society of Obstetricians and Gynecologists of Canada. What they've done is they've recycled a so-called consensus statement that they put together in early 2022. So it's more than 2.5 years out of date. The science is very much out of date. And even at that time, it was very much misinformed information that they were providing to pregnant and breastfeeding women. And I just want to show you the data, because as you know, those of us who have expressed concerns about COVID-19, the COVID-19 shots have often been labeled as providing misinformation. So I don't want people to just listen to what I'm saying. I want to actually show them the data. So I want to highlight something here, first of all, when it comes to women and why women in particular should be concerned about these shots. It was about 4 years ago when I expressed concerns about the systemic biodistribution of this so-called vaccine technology and how these little lipid nanoparticles, these fat bubbles, could get distributed throughout the body, causing cells throughout the body to potentially express the spike protein, which is known to be a toxic protein in the human body. I expressed concern at that time, but this is quite amazing, and I want to show people this because that was using data that I had obtained from the website of the Japanese government. And what was required when these shots are being considered under emergency use authorization, or in Canada as we call it, the authorization by interim order, is for these biodistribution studies, they ideally would capture the peak accumulation of this so-called vaccine technology in tissues in the body. And you should actually see it disappearing, right? We were told it would disappear from the body. They didn't capture that, but what they claimed to have captured was what they call a plateau. So at least they claimed they were showing that the concentrations weren't going any higher in the tissues. And so they could make this argument, therefore, that these shots probably wouldn't last in the body more than about 48 hours, which was the time that they ran these studies. So I want to show you what happened because this was not revealed to the public. And I find that this is actually very egregious. So in the Japanese data set, they had these curves, and it appeared that they had captured a plateau, right? A plateau for the accumulation of this vaccine technology, in this case in the liver, right? So it appears they captured a plateau. But what Pfizer did not disclose to the public was that this was a trick. And what I've done here is I've actually parsed out the data for males and females. And you can see in males, the concentration was going down at the end of the study, but in females, it was increasing. And so what they did to hide this increase, which would be should automatically have been a concern for any regulatory agent who's looking at this data. To hide that, they pooled the data for the males and females to give this false appearance of having captured a plateau. So this is just for the liver, where I'm just showing that example. But let me show you, if we go focus on just the female tissues, this is what the data actually looks like for females. It's skyrocketing in every single tissue that was assessed. These are 6 different tissues. Now look at these data here. Here's another 8 tissues from females, skyrocketing in all the tissues. They never captured, let alone did they fail to capture a peak. They certainly also did not capture a plateau. And this is very concerning for females. And let me just focus you in here on one piece of data. Look at the ovaries. It's increasing exponentially in the ovaries over the time course of this study. Any regulator should have looked at this and said, this is very concerning data for every tissue. But let's use the ovaries as an example. So what the regulator should have said is they should have compelled Pfizer to go back and look at the ovaries and say, this is very disconcerting findings. Does this mean that there is potential injury caused to the ovaries, right? And indeed, what's fascinating is a study just like that was just done, and it was just published a couple of months ago. And here are the data for this. And what it shows is the number of follicles in the ovaries of these same rats that were studied here. And long story short, between the control group, which has got a placebo, like a salt water injection, versus those that got the modified RNA shots, the rats, for all of the follicles were reduced in number, dramatically reduced in number. So let me put this in lay terms. The ovaries were decimated. The ovaries of these rats were decimated. Indeed, this very disconcerting data translated into overt damage to the ovaries of these rats. This is very disconcerting. And what also makes it disconcerting is we saw evidence of actual cover-up and lying about this information. And let me just show you an example. When the United States Food and Drug Administration released data from these biodistribution studies, here's an image of what they showed right here. And this is very concerning because they showed in the United States Food and Drug Administration release of the data, which they tried to hide for 75 years and only released when compelled by a court order, they had this one picture shown. And what this is this is showing, what you're seeing here are images of rats. You can see their tails here, and this is the lower end of the rats. Their legs are here, and this is the lower body of the rats. And they have their feet taped here. And this is an imaging technology which showed where these little fat bubbles, where these lipid nanoparticles were going in the bodies of the rats. You notice they have the image cut off here. And what they're showing is this is the large leg muscles. This is where they injected the vaccine into these rats. In people, they injected into the shoulder. In rats, we do the intramuscular injections into the large leg muscles. And they're trying to insinuate here that the only place where you see the vaccine going is at the injection site. So stays at the injection site, right? That was the classic mantra that we heard publicly.
It's actually hard to get it to stick around for long enough to get an immune response. And it probably only lasts in our bodies for about 2 days, maximum 2 days. And then it starts disappearing quite quickly. And because of the way it's picked up, it doesn't get carried around the body. It's in the location where it's injected.
The injection stays at the injection site. But this is the problem. They weren't expecting scientists like myself to put this data side by side with the information from the Japanese government. And there they had the exact same image. And I put them side by side here so you can appreciate by the shape of the tail, the shape of everything. These are the exact same images. They've done two things. By computer manipulation, they've changed the intensity of the signal so it gives the visual appearance of being a different image. It's not. These are identical images. And you see what they've done here? They cropped this image. And what did they do, Tamara? They hid this massive signal that was occurring in the upper bodies of these rats. This is in the area of the kidneys and the adrenal glands. And then when they actually reported this in their documentation, they excluded any statement of the signal being present in this location. Right here, you can see they showed images where it appeared in the liver, but they hid the data for the kidneys and adrenal glands. Why? Because the story that was being told, the narrative that was being told was that it stays the injection site and then it goes to the liver and the liver gets rid of it from the body, right? So it doesn't stay in the body. And that's what you can see here that they showed, that it only showed limited drainage to the liver. They completely ignored and hid this signal. This is, you can see with your own eyes, this is outright lying. This is lying by a health regulatory agency. And this is concerning because what the sum total of these biodistribution data suggest is that females are at greater risk than males, potentially, with this particular technology. So now we come to the issue of pregnant women and women who are breastfeeding. And this is the way that I view it, which is very important. There is an important concept. What we're talking about here is the Society for Obstetricians and Gynecologists of Canada. These are physicians. Physicians are obligated to facilitate what we call informed consent. Anybody, before they have any kind of medical procedure performed on them, are allowed to provide informed consent. And this is very important. So what is informed consent? We have a specific definition in Canada. This comes from Consent, a Guide for Canadian Physicians. The Supreme Court of Canada made a ruling on what the definition of informed consent should be in Canada. And this is what all physicians in Canada are obligated to adhere to. The definition by the Supreme Court of Canada for informed consent is this. Informed consent is what a reasonable patient in the particular patient's position would have expected to hear before consenting. So put into the proper context here, it's what a pregnant or breastfeeding woman would have expected to hear before consenting. So the big question here, when we look at the statement from the obstetricians and gynecologists in Canada, is this. They're basically saying the recent decision in the United States to stop these shots in healthy pregnant and breastfeeding women was an incorrect one. They're basically saying that and they're insinuating directly in their statement that it's misinformation, based on misinformation. So I pose this. For the Society of Obstetricians and Gynecologists of Canada, have they adhered to this concept? Have they facilitated this concept of informed consent to the satisfaction of the Supreme Court of Canada based on the definition we just looked at? Okay, so let's look at this. So here's important things that I would argue should have been disclosed to pregnant and breastfeeding women. There was an order paper question submitted in our federal parliament. And this is an opportunity where members of our federal parliament are able to ask government-funded agencies how they've gone about making certain decisions. So this is official information being disclosed in our federal parliament. This is information disclosed by Health Canada and the Public Health Agency of Canada. So this is in the documentation submitted to the federal government. You can read with your own eyes, and I've just highlighted a couple sections here. Look at what they said. So this is what Health Canada and the Public Health Agency of Canada have said. None of the COVID-19 vaccine manufacturers, and this is current, by the way, this is their current stance. This is not historical, this is current. None of the COVID-19 vaccine manufacturers sought indications for use in pregnant or lactating women. Okay, so that means the manufacturers of these products never even asked for these shots to be given to pregnant and breastfeeding women, nor did they submit any data from randomized controlled trials to support giving these shots to pregnant women. And look at this. This summarizes it in a nutshell. Health Canada has not approved any safety claims with regard to pregnant and lactating women. So again, I would ask, when it comes to informed consent, would you expect that a pregnant or breastfeeding woman in Canada would have wanted that information before they consented to taking these COVID-19 shots, let alone remember the fact that they were mandated for pregnant and breastfeeding women here in Canada. And I want to show you, your listeners, some additional information. These products have what we call monographs. It's like if you have a product that you buy for your home, a piece of machinery. Say you buy a washing machine, right? They always say refer to the manufacturer's directions, right? If you want to understand how to use it properly. So it's important for your audience to note that a product monograph, when it comes to vaccines, it takes precedence over any documented claims regarding safety and efficacy. So I've got an example here of Pfizer's product monograph. And it's it says very, very similar things to what Moderna's product monograph states. So I just want your audience to be able to see. This is a page taken directly from the product monograph. I've got a couple sections highlighted here. I've got them enlarged here for you to see. So let's read from this. What does Pfizer say about their own shot when it comes to pregnant women? They say no data are available yet regarding the use of Comirnaty, that's Pfizer's COVID-19 shots, during pregnancy. What about breastfeeding? No data are available yet regarding the use of their shots during breastfeeding. It is unknown whether the shots are actually excreted in human milk, and a risk to the newborns and infants cannot be excluded. This is incredible. So again, when it comes to informed consent, of course, any reasonably thinking pregnant or breastfeeding woman would want to have known this information so that they could make their most informed decision possible about these shots. How about this one? Here is information that was obtained through a Freedom of Information request. And this is early on when Health Canada was looking at cases of women who had been apparently inadvertently inoculated with the COVID-19 shots while they were pregnant. Because at that time, these were not to be given to any pregnant or breastfeeding women at all. And I just want to point out here for your listeners what Health Canada found. They looked at a total of 533 cases. And they had 193 total cases of what they call breastfeeding babies. So women who were breastfeeding their baby. And these women had received these shots. 41 cases. Well, I have a summarized for you here. Basically, what they found is that 21% of cases of breastfeeding women that had received these shots experienced clinical events. So the baby experienced clinical issues as a result of the breastfeeding mother having received these shots. And then of the mothers, when you look on the mother side, a full quarter of them, 25% of them experienced breastfeeding issues. This is huge. Again, this is information that women should have received in order to have been able to provide informed consent. Now, the other thing is, this statement that was just put out by the Society of Obstetricians and Gynecologists of Canada, they give the impression that it's supported by lots of science by linking to so-called consensus statements that they had made. So what they're basically doing is they're putting their stamp of approval, essentially renewing the statements again. They put them out again publicly. And in there, they publicly claim that any woman who has previously had an infection with SARS-CoV-2 still needs to get these shots. That is so outdated in terms of understanding. This is a partial list of 108 studies showing that naturally acquired immunity against SARS-CoV-2 is superior in every way, shape, and form to what can possibly be conferred by these COVID-19 shots. It is not recognizing the legitimacy and the superiority of naturally acquired immunity, nor does it recognize the ever-accumulating data that suggests that people who get multiple COVID-19 shots are actually more susceptible to getting COVID-19. And so this leads me to this, hard question at the end, which we need to pose, which is, would a pregnant or breastfeeding mom, again, if we go back to this, the Supreme Court of Canada's definition of informed consent, would a pregnant or breastfeeding mom have reasonably expected disclosure of things like the fact that Health Canada has not approved any safety claims with regard to pregnant and lactating women, that the manufacturers never asked for their shots to be given to these women, that no data were submitted to support giving these shots to these women, that Health Canada was investigating early post-marketing surveillance data showing that for breastfeeding moms that had inadvertently received the shots, 21% of their suckling infants had clinical issues, or how about that 24% or 25% of the moms had breastfeeding issues as a result of getting these shots? And should evidence of naturally acquired immunity been accepted as reasonable evidence of immunity for these women rather than mandating these shots to them? These are just some of the questions. In other words, what I would contend is this statement that the Society for Obstetricians and Gynecologists of Canada that they have just put out completely fails to meet the requirements of informed consent. And I would say that any pregnant or breastfeeding woman that has received these shots and either experienced issues themselves in terms of breastfeeding, or for which their infants have received or experienced any kind of clinical issues, that they should consider asking these tough questions and maybe asking the Canadian courts about whether these gynecologists and obstetricians have actually fulfilled their duty to facilitate informed consent.
Yeah. That's very powerful stuff. Thank you so much, Dr. Bridle, for sharing all of this research with me. And I look forward to hearing more as the science continues to unfold. Thanks again for your time.
Thanks for the opportunity.
For Rebel News in Hamilton, Ontario, I'm Tamara Ugolini. If you'd like to find more reports just like this one and support this kind of work, please do so at nomoreshots.ca. That's nomoreshots.ca.